Okay, so I'm gonna try and get through this pretty quickly because my camera likes to die when it's at 2 bars. So, let's go. This video is about my top surgery consultation with Dr. Taylor here in British Columbia, Canada, because I had that on the 8th of September and it's currently September 23rd. I did actually film this video a little while ago, and then I was editing it and I really didn't like how it turned out. So I'm doing it again with a lot nicer stuff. You know. Of course the fridge decides to speak up right now. So a rundown of kind of the timeline of things, which by the way is not a normal timeline. In early March, I finished my top surgery surgical readiness assessment, which you have to do here in BC to kind of qualify and get coverage through MSP, which is the medical. It's either I think it's medical services plan of BC. So I finished that with Dr. Knudsen, and then they didn't send my papers to my doctor until May. And I think the official date that my papers were sent off, that the fact that I had passed my test, or the assessment, was sent off around May 23rd. Then I was put on the waiting list. So basically, for top surgery, you get put on a massive waiting list, and then Transcare BC will call you and ask about what surgeon you want, basically. After you've picked, they refer you to that surgeon, and then you get put on their waiting list, and then you will get a call for a top surgery consult. So I got my call from Transcare BC on August the 24th. Usually they take 6 months, I think, for you to get a call from Transcare BC, which is that's the norm. I had actually emailed Transcare BC to ask about whether or not my paperwork had actually been, sent off, because I wasn't sure, especially after my first experience with Dr. Knudsen, just not sending it to my doctor. I just wanted to make sure, and they got back to me pretty quickly, telling me what date that my paperwork had been put through and I was put on the waiting list. And then they also told me an approximate time of when I should get my call to pick my surgeon. And the date that they had was November. So yeah, it went really, really fast. So I got my call, and basically what happened was they call you, they ask what places you want to hear from. So there are several surgeons throughout the province. I think there are 3 in Victoria, 2 in Vancouver. I know there's 1 in Kamloops, and I know there's 1 in Kelowna. I'm not totally sure about any other places. But yeah, you can choose which wait times you want to hear. So I only wanted to hear the ones in Victoria, in Vancouver Island, because that's where I am. So those are the only wait times that I have, but if you go to the kind of FTM British Columbia Facebook page, somebody else posted more dates and waitlist times, if you wanted to check that out. I just got that written down. So for Chris Taylor, they told me 1 to 2 months for a consult, and then 4 to 6 months for surgery after the consult. So those are the general wait times of how long it will take for me to get surgery and a consult. For Chang, it was 1 to 2 months for a consult, 4 to 6 months for surgery, and Dr. Robinson was 3 to 6 months for a consult and 6 to 8 months for surgery. So hers was the longest. I picked Dr. Chris Taylor, obviously, and they told me that they would send off the referral to him, and then I should be getting a call in a few weeks for them to schedule my consult. So that's all tickety-boo. So I'm a student, and I started school on September 5th, and on that day, keep in mind this is only 2 weeks after my Transcare BC call, I get a call from Dr. Taylor's office asking if I want to come in on that Saturday, which is the 8th. And of course I said yes, so I scheduled my consult for 10:30 on September 8th, 2018, and yeah, that was super amazing. This is why I said before that this timeline is not what it usually is. Usually there's a lot more wait times. So as I said, I had my consult with Dr. Taylor on September 8th, 2018, and I have quite the list of things that I wrote down, kind of detailing what happened, so I'm gonna very quickly read what I wrote down in my notes. Editing Harper here, I just wanted to mention that when I got my call, they sent me an email to a link to a just kind of like a standard questionnaire from Dr. Taylor's office, just asking about medical history and stuff and what you're contacting Dr. Taylor about. And when I saw him, we went over it together just to kind of confirm and kind of be on the same page about everything. So when I got there, I signed a consent form for before and after pictures to be taken for his portfolio and any kind of academic or medical articles or papers. You're allowed to say no, and you're also allowed to only want it for his portfolio or only want it for such and such a thing, just so you know. I got taken into the room at 10:36 to wait while he finished up with someone else, which is very normal. I noted here that it looked like a typical medical office except with a floor-length mirror leaning against the wall. I guess that was relevant to me at the time. He then came in to introduce himself, ask my pronouns and what I wanted in terms of like the surgery. Like he can do reductions. I've heard a few non-binary people who didn't want like kind of fully masculinization of the chest. They just wanted kind of like a reduction to like a small A. And then I got given a open gown, which they wanted open at the front for understandable reasons. I got to keep my pants on, just had to take off my top. His assistant or she was at the front desk. I'm not totally sure what her title is, but she came in to do some measurements with her measuring tape. She did from collarbone to nipples. She did the circumference of my body just underneath like my breasts, and she also took the kind of before photos, so it was just like one like from the front and then two profiles. After that, I was just told to wait, and she left, and then Dr. Taylor came back in. He did a few more measurements. He measured the actual like diameters of my areola. He measured from the middle of my chest to each nipple. He measured how like basically far my nipples stuck out, and I think that was all of the additional measurements he did. He took a look at my chest, obviously, and he said just based on size that I would have to get double incision. He said my skin elasticity was really good, which is apparently common in people my age and people of my ethnic background. So basically, I guess Asians or Chinese people. He left, I got dressed, he came back in, and we went over the procedure. He said he'd talk about kind of post-op care closer to my actual surgery, and also I have to have a pre-op appointment with my GP, so that will happen. I think she said at least 3 weeks before my surgery. I personally had the question of, is it okay if I sleep on a bed that is on the floor or if I sleep on a couch? Because my bed is a mattress on the floor, and the other alternative is a couch, which is basically like a love seat. It's just like a two-person couch because there's two people in this apartment. He said that his receptionist usually organizes the time, like the times and dates of the surgery, so I should be getting a call from her about my top surgery date, which I haven't gotten yet. Other things we talked about in terms of the actual surgery was that he told me the risks of surgery, so that's like lots of bleeding, the risk of dying under anesthesia, the risk of having a lot of fluid even after the drains come out. You could potentially lose a nipple because I'm getting double incision, which usually comes with free nipple grafts, which basically means that they just literally cut your nipple out in your areola, and then they stitch it back on afterwards. So sometimes if the graft doesn't take, it can literally just fall off. So that's always a risk. Obviously scarring, since they're just cutting underneath here. And apparently because of my skin tone, the scarring might be a little more severe than, say, white people, I suppose. And he also said that we are going to talk about the placement of the scars right before the actual surgery, on the day when he marks up my chest. He said that I could either have lines that are kind of more straight, just straight here, or I could have lines that kind of curve up, and so it kind of outlines the pec. So yeah, we can decide that later. He also said that just because of wait times, that the surgery will almost certainly be after Christmas, and that also means for me that it will probably be after winter, just because driving along the Coquihalla is scary. So for me, that will probably be around late April, early May, because I am in school. And my last note was that the appointment was for 10:30 a.m. He got into the room at 10:36 a.m. and my appointment ended around 11:15. So about 45 minutes in all up. I don't really have a lot more to say. In terms of Dr. Taylor himself, I thought he was really, really nice. I've heard a few people say that he was kind of robotic and not like personable and not very friendly, but like I don't care too much about whether he's personable or friendly, or I just want him to do a good job and know what he's doing. But also I found him perfectly nice. Like he was very soft spoken. He asked me about my pronouns and he kind of joked around a little bit. So yeah, like obviously it's subjective how you feel about a person and your impressions of them. Yeah, he made me feel very comfortable. He asked like before touching me and doing this was okay, or if like asking this was okay. He's a nice guy. I hope he does a real good job in my surgery. I went with Dr. Taylor because I like his results, and I've also seen more of his results than any of the other Victoria surgeons. Chang is pretty new, and I just haven't seen any of Robinson's results. Also, her wait times were so much longer. If you have any more questions about, the consult or the process, you can definitely either contact me on any of my social media, or you can leave them down in the comments. Otherwise, I'm gonna go. Bye.